Well, thank you very much. I'm always happy to speak about unique pain management in cats because I know those of you who are cat owners or who are owned by cats, really, and cat lovers know that cats do experience pain, and sometimes it's difficult for us to realize that they're painful, and if they're painful, how do we treat them? Because they aren't always really amenable to taking medications, supplements, or herbs that I or other veterinarians want them to have. Now, I am a canine diplomat of the American College of Sports Medicine and Rehabilitation, not an equine one, but they don't have a feline one. However, in the curriculum now for our residents, it is now canine and feline, even though we don't have really any sporting cats. So I thought it would be good to start out with talking about visiting your veterinarian with your cat, because those of us who have cats probably already understand most of the things on this slide. We know that cats don't travel very well, they don't like to be away from home, and they are very highly sensitive to unusual sights, sounds, and smells. Most cats really prefer quiet and solitude, and they can be very susceptible to stress and anxiety. And if you take your cat to a veterinary hospital that has dogs, you do know that they can be highly stressed by dogs or even other cats just being in close proximity at the veterinary hospital. So veterinarians need to remember that cats have to be handled gently and with care, and they need to be handled with respect in any veterinary practice that you take them to. So in my practice, we do try to reduce the stress of taking your cat to the vet. And how do we do that? Well, one of the things that we use is this feline pheromone spray called Feliway. And we also recommend that our clients pre-adjust their cats to the carriers and that use proper carriers. Not, I have seen cats come in all kinds of things, a laundry hamper with the oven, the rack out of the oven on the top of it. You need to use proper carriers that are big enough for the cat and that you can carry not just by the handle where the cats are going to swing around, but that you can pick up and carry. And that's why I say learn how to carry the cat carrier, because think about how you would feel if you were a cat in a carrier and suddenly you're going like this, you're going like this, you're going up, you're going down. You would not feel very confident about that. And one thing that we will use in my practice is if we have cats that are very, very stressed and they don't, have any, if it doesn't help with Feliway or any of the other things that we use, we recommend that the client take the cat back home and we give them some gabapentin to sedate it, just so that the cat is able to be handled, because we don't want them to be fearful. So how are other ways that we can reduce the stress on the cat, out of taking the stress out of the cat when you're going to the vet? Because this is a big problem. And a lot of times people won't bring their painful cats to the vet because they don't want to bring the cat in. So I recommend that we allow the cat to stay in the carrier maybe for the exam, if that's what they like. A lot of the times we're recommending that you put the cat carrier on the floor, put a nice blanket out there, yoga mat, something that the cat could lay on, and then take the top off the carrier, let the cat come out, let the cat explore, not dumping the cat out, not pulling it, not scruffing it, because remember that fear and pain are very much interlinked with cats. So this is something you can look for in a veterinary practice that you go to. And this is a fear-free certified practice, because there have been some research done that cats who come to cat-friendly, fear-free practices are often less stressed, less painful, they heal better, and they have better immune systems. So you can look for this. When I have here, consider being fear-free certified. Well, that's really for veterinarians. And that link there is really for the veterinary hospitals, but you can have a look and see what fear-free practice is like, and maybe have a look at taking your cat to a fear-free practice or to a cat-friendly practice. And if you can look up cat-friendly online as well. So, one of the things that I think owners have a hard time doing is recognizing when their cats are in pain. Because, unlike dogs, I see a lot of dogs who are limping. We know, well, that dog has a sore leg, it's limping. But cats frequently, if their mouth is painful, if their tummy is painful, if their legs are painful, what do? They just kind of keep to themselves. And so, the best way to tell if your cat is in pain is by looking at its behavior, because behavior helps you assess how much pain the cat's in and how much are they adapting to it. So sometimes we're looking at loss of normal behaviors, like, for example, perhaps a cat with osteoarthritis may not be able to jump in and out of the litter box. So instead, they're peeing and pooping right at the entrance. So that's going to be loss of a normal behavior and probably a new behavior. And the cat might be doing it because it has bladder pain, but it may have osteoarthritis. So behavior is the key to recognizing pain in cats. And this is something called the Feline Grimace scale, and it was put together by the people at the University of Montreal. But if you look at this, this is showing you the cat that is on your left with the big eyes and the ears forward. That's pretty normal cat. It might be a little bit startled, but it's not really a painful cat. Whereas look at the cat in the middle. See what the ears are doing. They're more flattened. The eyes are more squinty. And then the cat on the end is actually showing quite a bit of pain. And so they have, I've put the research number in here for those people who like to look up papers, but pretty much this is a validated thing. So they can tell how painful the cats are by looking at their faces. And here's something else. Look at this cat's face. It looks like that third cat in there. And a lot of times when they pull their hind legs up, or when they flex and extend their legs when they're laying there, then they're in pain. This was a cat after an ovarohysterectomy, a spay procedure. So how about other indications of feline pain? Well, it can be litter box changes, as I said. Perhaps the cat isn't getting in and out of the litter box, or maybe the cat has bladder pain, has some cystitis, and then maybe is peeing outside the box, and then of course there may be blood in it. If you go to pet your cat and the skin is rolling, or if the cat's grinding his or her teeth, or they're doing excessive licking at the air, those are all signs of pain. If you have a kitty who is either too big to get back to the back end and can't groom, or this cat here, he's not really fat, but he's not grooming himself very well. A lot of times, decreased grooming can indicate pain. Cats who are incontinent, who pee, all over, have constipation. A lot of times, if they're not eating, that can indicate pain. Quiet hiding, sometimes vomiting. A lot of times, you go to pet the cat and the cat hisses at you. That sometimes is a sign that your cat has back pain. So this little thing comes from Dr. Mike Petty's book about pain in cats, but it shows you some interesting things. Here we have in the top, arthritic cats might use a chair to help them jump onto a table, whereas a healthy cat can jump, from the floor to the table really easily. Your arthritic cats that are painful are going to play less. They're going to sleep more. They're very hesitant to climb stairs. And they may be hesitant to jump off tables. If they're going down a counter, you've probably seen this with your cats. They have their back end up on the counter and they put their front end so that the front end slides down first. And we call that the arthritic slide. So that's something that you can look for. I certainly have had clients who have said to me, oh, my cat, after all these years, doctor, has finally learned not to jump up on the counter. Well, the cat's now 12 years old. It hasn't learned. It's too painful to jump up on the counter. So those are things that we need to look at. And I just one of the things that I really like is for my clients to video their cats moving at home, because if they're sitting on the floor in my exam room, I can't see that. So if you have a cat that you think is painful, then make sure you take out your video camera and you video the cat moving, and then you can show it to your veterinarian, and then he or she will determine that, yes, this cat is indeed painful. You'll see this little kitty walk away in just a minute, and you'll see how painful he is. So again, these are client videos, So sometimes it's not quite as much. Oh, you're like, yeah, this cat's pretty limpy. So that really helps me as a veterinarian. So, how do we treat things like feline degenerative joint disease? Well, we can talk about treating them with drugs, and we may talk a little bit about that in a bit. But a lot of times, I am having my owners modify the environment for the cat. So, when I talk about modifying the environment, I like some elevated dishes. I like carpet runners and rugs so that the cats have a very good footing, to walk on. They don't skid and that kind of stuff. They need soft bedding and warm places to stay. And, if there are areas that you're concerned that this old cat is going to get down and you want to keep him from going down the stairs or going up the stairs, then putting in gates or baby gates. And now harnesses, assisted devices, slings, and carts, those certainly you could use in kitty cats, but we probably use those a lot more in dogs, although I have had cats in wheelchairs, but that's not a common thing. So how about access to the litter box? Here's an example of what I was talking about, and I have a few photos here that are Sheila Robertson's. She and I did some team teaching in cat pain, and she had some great photos, so I used these by her permission. So if you have this great big litter box here, and a normal young cat can jump in and out of the one on the left. But as you can see, our older cat couldn't get in there. So he just kind of pooped where he was. So how do you fix it? Well, you cut it down so that the cat has better access to the litter box. And it's great if they have access still to elevated places. So this poor cat on the left might want to get up into the windowsill, but really can't jump up at that point. So instead, he's just there on the floor, but he really would rather be elevated. So here we have a little stool for him, and he can still look out the window, which is one thing that he really needs to do. So that's helpful. How about things like weight control? Because unfortunately, I do see a lot of painful cats who are overweight. So at least 50% or more of our cats are overweight. And one of the things that I like to tell my clients is that fat is pro-inflammatory. Well, that's kind of a big word, but it just simply means that fat produces inflammation, or I like to say to my clients that fat equals pain. And here's the thing, 6 to 9% weight loss is going to improve the function of your cat significantly. And I like to figure out calories that cats require, and I like to give my clients an idea of how much they should feed to their cat. And the big thing is that free feeding of cats is a true no-no. You need to use some sort of feeder. If you're not there, that's going to meal feed only an amount, or the little puzzle feeders, or as long as you don't have a dog, the balls that release little bits of maybe dry food at a time. But it's a very difficult thing to do because the ME, which is the metabolizable energy content of food, may not be reported on the bag, or you as a pet parent may not know what it is. And the labeling on these pet foods is often inaccurate because they will label it for the most active breed of cat and the most active sex. So that's going to be the unneutered, the intact male cat. And a lot of times if people are feeding excessive treats, we don't see as much table scrap feeding with cats, but we do see excessive treats. And all of those treats have calories in them. So talk to your veterinarian about calculating out how many calories your cat needs and perhaps getting them onto a weight loss diet. A prescription weight loss diet is usually going to give you the most bang for your buck. And how about treating these cats with drugs and non-drugs? Well, there's many drugs that we can use to treat cats. The problem with cats is twofold. One is there are some pharmaceuticals and drugs that we use in ourselves, that we use in dogs, that we might even use in horses, that you just can't use in cats due to the cat's very sensitive, very specific metabolism. And the second thing is there are many cats who, even if I think they should take a medication, the cat does not agree with me. And so therefore we end up not being able to give the medication, or using things like injectables or ones that you put topically in the ear, but those do not always work very well. I did want to just bring out this, and this is kind of a sciencey thing, but this is not on the market yet. It was supposed to be out this September. However, with COVID, everything is way behind, but this is something called anti-nerve growth factor, and it is a monoclonal antibody. So what it is this is an injectable for dogs and cats that's going to come out, and it's like vaccinating your cat against osteoarthritis pain. That's pretty much the easiest way to think about it. But if you really want to read Mark's paper, you can look that up online and read it. But pretty much what this will be a new product. So then you may have to take your cat into the veterinarian once every 6 weeks, once every 8 weeks, for an injection that'll help with pain for osteoarthritis. It's kind of a cool new thing. So what are some things I have been able to get cats to eat that might help for pain? Well, one is fish oil. There's lots of studies that fish oils work in people, in dogs, and in cats to help decrease inflammation and pain. And we're talking mostly about osteoarthritis then, but the fish oil is going to help anywhere that the cat has inflammation. So I often use fish oil or green lip mussel for cats who have bladder pain, so cats with cystitis. I may also use it for cats who have dental pain, but it can take up to 8 weeks to work. And this is the dose in milligrams per kilogram. So it's 50 milligrams per kilogram, or about 50 milligrams per 2 pounds of cat. And you don't want to go over that dose, because cats, again, are sensitive even to fish oil, and you can cause a problem with platelets if you go any higher than that. So this is a product called Antinol, which is a green lip mussel derivative. I really, really like it. I use it with every cat that has interstitial cystitis, because it's very, very good for inflammation anywhere, but particularly in cats in the bladder, for joints, and in the respiratory tract. So I like this. One of the reasons that I might pick this for kitties over just straight fish oil, the fish oil is great. You can get a liquid, you can mix it in the cat's food if the cat likes it. But if the cat isn't super keen on fish oil, then Antinol might be better. You can pill them with these little tiny pills, or there's only about 2 drops of this product in there. So you could puncture it with a needle and mix it with something that the cat really liked. I did some lecturing in Asia, and this is extensively used in dogs and cats in Asia. They reach for this before they reach for pharmaceuticals. And then people are always asking me about CBD, because hemp has so many uses. We could talk an entire webinar on the use of CBD in hemp, but what you need to remember is talk to your veterinarian before you're going to put your cat on anything, including CBD. There are some that are better than others, that have been tested, really have been really well tested, but you should really talk to your veterinarian about that. If you're in the US, I know the LVET people have a good product. There are a couple of other ones, Charlotte's Web. You have to be very careful that you don't get ones that have THC or that have the wrong amount of THC in them, but they can be used for cats in pain. Now, how about other cool things, unique things that you can use for painful cats? Well, in my practice, I do acupuncture. So this is very, very good for pain. And cats usually really take quite well to acupuncture. I think that they respond to acupuncture better than any other species on the planet. So it can be used for pain relief, surgical or post-surgical analgesia, also if there's inflammation, muscle tension, and we're going to use it for osteoarthritis and hip dysplasia. I do if IVDD, FCE, so in cats, the thromboaortic embolism, the blood clots that they get, that certainly is possible. And I use it for my cats in kidney failure as well, because it helps increase the blood flow to the kidney. So acupuncture is a great thing. And these are just some of my patients having acupuncture, and they usually do extremely well. I have done this on really not very nice cats either, and generally they'll let me put the needles in. So laser therapy is something else that we do in cats, and why it's non-invasive. And I find in my practice, the clients want things that are non-pharmaceutical. And so laser is one of the things. And there's now really good lasers out there. I wouldn't recommend that you buy the cheap little ones off of Amazon, which are really light therapy. You need to go see a veterinary physical therapist or your veterinarian to get the proper laser treatment. This is just one of my patients. This is Coco. She's a very geriatric cat. She's 18 years old. And here we're doing some laser on her lower back for her hyperesthesia. She also has shoulder pain, but she comes in now about once every 6 weeks and gets laser, and I do some chiropractic on her, and it's been very, very helpful for her pain. Now, here's something that is really great, and this is pulsed electromagnetic field therapy. And these cats have a CC loops on them, and I love these CC loops in cats. Most cats have no problem with laying still and having one of these little loops put on them. But I have a little bit of the science here for you, just so that you know where these came from. And these were originally cleared for humans for pain, for women post-mastectomy. And what they found when they used these on the women was that there was a lot of reduction in opioid use and inflammation post-surgical, and there was decrease in all these nasty inflammatory factors like IL-1 beta, which is interleukin beta, and a significant reduction in narcotic use. So that was how these started out. And how this works, this just sort of shows you on the left a healthy cell where you have your positive and negatives, your potassium and your sodium ions are in balance. And then we have a disease cell where you see everything's all kind of jumbled. So the idea really of your pulse electromagnetic field therapy is that it strives to bring everything back into a normal distribution and a normal balance. And then this is sort of the science behind it, where it increases your growth factors and it decreases your inflammatory cells and your prostaglandins. And here's where it shows you an increase of osteoblasts. So this is why we will use this for bone healing in dogs and cats and horses, and you can use it in people as well. But these are all of the things that this pulse electromagnetic field therapy is going to do. Now, one of the things that I really like about the CC company is that they try to do some research to prove that their products work. Now, this is a canine osteoarthritis study that they did and has been published, where they did 20 days of the CC PEMF, and they compared it to Previcox, which is a non-steroidal anti-inflammatory. Both of them worked. But what they found was that when the Previcox, when the non-steroidal anti-inflammatory was done, that the relief ended shortly after the therapy, whereas the PEMF effects were still in place in some cases 4 to 12 months after the cessation of the therapy. So how often do we apply our loop? Well, in acute conditions, we like to put it on to the patient for 3 to 4 treatments daily for the first week, and then decrease over the next week until the condition is healed. You can use it for chronic and degenerative condition. You can use it for dental pain. You can use it for bladder pain. You can use it for osteoarthritis. Pretty much just any place in the cat that's painful, you can use this. You can use it in cats who have had cancer, and you can use it in animals who have seizured. So that's also a good thing. What we can do is we can decrease to 1 to 2 treatments daily and decrease further to 1 to 3 treatments per week or as needed. And this is a very, very cool thing. So this is something that a CC has come out with, and this is a Sleepy Pod cat carrier that has 2 CC loops built into it. So what you do is you put your painful cat in the carrier and you zip it up. You turn on this Sleepy Pod, and you let the cat sit in there for 15 minutes, and it's going to get a treatment wherever it's painful. And we do use this. We like this particular product. And like when you talk about hands-off pain, unique hands-off pain treatment for cats, this is it, because the cats don't have to do anything, just lay there. And we've seen significant improvement in many cats with this particular thing. And this is a cat laying on a loop lounge, and the loop lounge is really probably made for veterinary clinics, but I don't see any reason why people who have multiple cats and may want to use this could purchase it. And again, it's pretty much the CC loop technology, but we have a little control thing there to make it rechargeable, which is really, really good. And so a lot of times, and the animals know when it's on. When we put patients on this in the hospital and we turn it on, like, they have relief. And many times, once their treatment is done, they get up and walk away because they know that things are done. So I'm a rehabilitation person, and so there's no reason why cats cannot have exercise. And exercise is really very good for all bodies, particularly if you're painful. I like the adage that is motion is lotion. So if you have a painful joint, and certainly you can perhaps use your CC loop, and then we would use some exercise with these cats to get them moving. And this is just showing you a couple of different exercises that you can do with these cats. And so we do put cats over these little cavalettis. That's what these white poles with the red hockey tape on there. They're just an obstacle that the cat's walking over. It makes them flex and extend their legs. We also can put cats on balls and have them walk back and forth. Or at the bottom here, we have a cat that is on a wobble board. And you don't have to make a wobble board for a cat. If you want to give your cat a little bit of exercise and get its joints moving, and you don't have a wobble board, which most people don't have, if you inflate an air mattress and you get your cat to walk over that, that's a good thing. A lot of times we will set up little obstacle courses, but you have to get the cats to cooperate with them. Other things that work as well for this are, manual therapy. So a lot of my clients have learned certain massage moves for their cats, or Tweena. I obviously do chiropractic. People don't think an awful lot about having chiropractic done on their cats, but cats respond so well to manual therapy of any type that I think that's great. I have a number of cats who will come in for some chiropractic, and then they may go in, and sit on our loop lounge for a while. And there are many who massage is really very, very helpful. And there are courses as a pet owner you can take in massage and also in acupressure for cats. Now, I do acupuncture, and really veterinarians are the ones who have to be trained to, to do the acupuncture. But pet owners can very easily learn to do acupressure. And, just because I have an underwater treadmill, I do put cats in it. Really good for weight loss, and also to get these cats moving. And so it's not an unusual thing that we will put cats in our underwater treadmill. It's obviously not something that you would do. And I would recommend training if you're planning to do water therapy in cats. But you certainly can use toys, especially for kittens, to get them to move around, and that's going to be very helpful. And when I have here using carriers, so if you have a cat that really likes its carrier, a lot of times we will use the carrier as the reward for the cat, and we'll take the cat out of the carrier, put it across the room, and have it walk back to its carrier. I did have a client who was trying to get her cat to lose weight, and the cat loved to run around in the garden with her. And she was an older lady. It was a pretty heavy cat. And so she put the cat in her wheelbarrow, and she would wheelbarrow the cat to the end of the garden, which was, I guess, a fair length of land. And then she would get the cat to come out of the wheelbarrow, and she would take it back up to the front. And the cat would run up to the front and get a treat, which, I'm not sure that really helped so much with the weight loss, but they were low calorie treats. Anyway, she did get the cat to do that, but it just requires you to think a little bit about what your cat might like. A lot of cats like laser pointers and feathers, and then you can get them to exercise. And certainly if you start playing with them when they're young and you're getting them to exercise, when they're older, then you're able to get them to maybe do an obstacle course following a laser or something along that, because there is a thing that exercise reduces pain. And so if we can get these cats moving, we can get them a lot less painful.